Hello everyone. Welcome to today's video. Before we dive into our main topic on breast cancer, let's start with some USML-style questions to get your brain warmed up. Ready? Here we go. 1. What is the recommended frequency for clinical breast examinations for women aged 40 and above? A. Every 3 years. B. Every 2 years. C. Annually. D. Monthly. Answer: C. Annually. Explanation: women aged 40 and older should have clinical breast examinations annually. This is crucial for early detection of breast cancer. Regular exams help in identifying any changes or abnormalities that might indicate cancer. 2. Which imaging technique is recommended every 2 years for women starting at age 40? A. Ultrasonography. B. Mammography. C. MRI. D. CT scan. Answer: B. Mammography. Explanation: mammography is the standard screening tool recommended every 2 years for women aged 40 and above. It helps in detecting breast cancer early, even before symptoms develop. 3. Which of the following is not a risk factor for breast cancer? A. Female sex. B. Early menarche. C. Nulliparity. D. Low-fat diet. Answer: D. Low-fat diet. Explanation: while high-fat intake is a risk factor, a low-fat diet is not associated with an increased risk of breast cancer. Other risk factors include female sex, early menarche, and nulliparity. 4. What is a common symptom of breast cancer? A. High fever. B. Persistent cough. C. Lump in the breast. D. Abdominal pain. Answer: C. Lump in the breast. Explanation: a common symptom of breast cancer is a lump in the breast. This lump may be painless or painful and can vary in size. It's often one of the first signs prompting further investigation. 5. What imaging technique is typically used to assess the breast for cancer after an initial abnormal mammogram? A. MRI. B. CT scan. C. Fine needle aspiration. D. X-ray. Answer: A. MRI. Explanation: MRI is often used to further assess abnormalities detected on a mammogram. It provides detailed images of the breast tissue and helps in evaluating the extent of cancer. Now, let's delve into the topic of breast cancer. Breast cancer is the most common cancer affecting women globally. Early detection is key to improving outcomes, and this can be achieved through various methods. Monthly breast self-examination is recommended for women of childbearing age. This allows for the early identification of any changes or abnormalities in the breast. For women under 40, clinical breast examinations should be done every 3 years. Women over 40 are advised to have these examinations annually. Additionally, mammography, an essential screening tool, is recommended every 2 years for women aged 40 and above. Treatment for breast cancer is highly individualized. It depends on the tumor's biological characteristics, disease stage, and other patient-specific factors. It's important to recognize that breast cancer also affects approximately 2% of males in Ghana, highlighting the need for awareness among all genders. Several risk factors contribute to the development of breast cancer. These include female sex, age, genetic predisposition, family history of breast cancer, a previous personal history of breast cancer, prolonged exposure to estrogen, early menarche, late menopause, nulliparity, not having given birth, and the use of estrogen therapy, such as contraceptives or hormone replacement therapy. Lifestyle factors like high fat intake, alcohol consumption, and tobacco use also increase risk. Despite these known risk factors, the exact causes of breast cancer remain largely unknown. Common symptoms include a lump in the breast, changes in the size or shape of the breast, swelling in the axilla or upper limb, peau d'orange, a change in skin texture, skin nodules or ulceration, nipple discharge, nipple retraction, and eczema or ulceration of the nipple or areola. Signs of breast cancer include a palpable breast lump, peau d'orange, skin tethering, nodules, or ulceration, nipple retraction, bloody nipple discharge, palpable axillary nodes. Symptoms of metastatic breast cancer, where cancer has spread beyond the breast, may include bone pain and pathological fractures, back pain and paraplegia, cough or breathlessness from lung or pleural effusion metastases, headache, vomiting, altered consciousness, and localizing signs from brain metastases. To diagnose breast cancer, various investigations may be performed. Mammography, an essential screening tool that helps detect tumors early. Ultrasonography, useful for evaluating the characteristics of a breast lump. Fine needle aspiration, a diagnostic procedure to extract cells from a suspicious area for cytology. Core biopsy, provides a sample of breast tissue for a definitive diagnosis. The objectives of breast cancer treatment are to achieve a cure, prevent local and distant metastasis, prolong survival in metastatic cases, and relieve pain and suffering. Treatment options include non-pharmacological treatments such as psychological support, palliative care, surgery, and radiotherapy. Pharmacological treatments like chemotherapy, hormonal therapy, and immunotherapy. For any suspected case of breast cancer, referral to a specialist is crucial for comprehensive evaluation and management. Breast cancer is the most common cancer affecting women. Early detection is crucial and can be facilitated through monthly breast self-examination, which is recommended for women of childbearing age. Women under 40 should undergo clinical breast examinations every 3 years, while those over 40 should have them annually. Mammography is recommended every 2 years for women aged 40 and above. Treatment for breast cancer is personalized, depending on the tumor's biological characteristics, disease stage, and other patient-specific factors. It is important to note that breast cancer occurs in approximately 2% of males in Ghana as well. Risk factors for breast cancer include female sex, age, genetic disposition, family history of breast cancer, previous personal history of breast cancer, prolonged exposure to estrogen, early menarche, late menopause, nulliparity, estrogen therapy, contraceptives, hormone replacement therapy, high fat intake, alcohol, and tobacco use. The causes of breast cancer are largely unknown. Symptoms may include lump in the breast, change in the size or shape of the breast, swelling in the axilla, swelling of the upper limb, peau d'orange, skin texture changes, skin nodules, ulceration, nipple discharge, nipple retraction, eczema or ulceration of the nipple or areola. Signs of breast cancer include breast lump, peau d'orange, skin tethering, nodules, or ulceration, nipple retraction, bloody nipple discharge, palpable axillary nodes. Symptoms and signs of metastatic disease can include bone pain, pathological fractures, back pain, paraplegia, cough, from lung metastases, breathlessness, from pleural effusion, headache, vomiting, altered consciousness, and localizing signs, from brain metastasis. Investigations for breast cancer may involve mammography, ultrasonography of the breast, fine needle aspiration for cytology, core biopsy. Treatment objectives are achieving a cure, preventing local and distant metastasis, prolonging survival in metastatic disease, relieving pain and suffering. Non-pharmacological treatments include psychological support and counseling, palliative care, surgery, radiotherapy. Pharmacological treatments include chemotherapy, hormonal therapy, immunotherapy. All cases of suspected breast cancer should be referred for specialist attention. Thank you for watching. If you found this information helpful, make sure to like, subscribe, and click the notification bell to stay updated with our latest content. Feel free to leave any questions or comments below. See you in the next video.